Hi dear all. Today I am sharing a video on pulmonary arterial hypertension. The pulmonary arterial hypertension is defined as the resting mean pulmonary arterial pressure of more than 25 millimeter of mercury, or the mean pulmonary arterial pressure following the exercise is more than 30 millimeter of mercury. Now if you talk of the causes, in children, usually there is some underlying etiology which leads to the PAH, that is pulmonary arterial hypertension. In maximum of the cases, cause is congenital heart disease. So PAH is commonly associated with congenital heart disease. Other is respiratory diseases can be associated with the PAH. Also the upper airway obstruction like Downs or adenoid hypertrophy can lead to PAH. Then the liver disease, if it is severe, may lead to the hepatopulmonary syndrome. Also, the mutations in the bone morphogenetic protein receptor type 2, that is BMPR2, or the activin receptor like kinase type 1 or endoglin can lead to PH. Connective tissue disorders can also be associated with the PH. Sometimes it may be idiopathic. Now, if we talk of the clinical features of the pH, how the pH will present, it depends on the degree of the pH and also depends on the right ventricular status. The most common symptom is exertional breathlessness, which occurs due to the inability of the right ventricle to increase the cardiac output along with the exercise. Another features which may be present are like hemoptysis, atypical chest pain may be there, congestive heart failure may be there, it may present as a syncope or arrhythmias. Cyanosis may be seen in Eisenmenger. Also depends on the cause. Now, how we are going to manage this PH, that is pulmonary arterial hypertension. The very first thing, there may be some underlying hypoxia. If the patient is having this PH due to pulmonary disease, or if the patient is having this PH along with the right ventricular failure, then there will be hypoxemia. For that, we need to supplement the child with the low flow oxygen. Another thing, this right ventricular failure may be there. So to manage this congestive heart failure, we need to give the child diuretics. But excessive diuresis should be avoided as it can lead to the fall in the cardiac output. Also, we can use the phosphodiesterase inhibitors like sildenafil and tadalafil, which inhibits the breakdown of the CGMP and potentiate the pulmonary vasodilatation. So this oral sildenafil and tadalafil can be used to reduce the pulmonary arterial pressure. Also, the endothelin receptor antagonists like bosentan or ambrisentan can be used, which are the selective pulmonary vasodilators. Also, the prostacyclin analogs, which can be administered IV or subcute, like epoprostenol can be used. In certain cases, there is risk of the thromboembolism. For that cases, we need to give the anticoagulants. Also, the final resort may be the heart-lung